Hi, I'm Dr. Sharon Varela. I am a rural and remote psychologist. I was born and raised in Inangai country and Kalkadoon country in the Western Queensland corridor. And I have lived experience as a rural and remote person, as well as practice as a rural and remote psychologist for many years. I ended up studying in the city, as many psychologists do, and I returned to rural and remote about 8 years ago. Originally, when I returned working for James Cook University, supporting other psychologists in allied health across the Western corridor, as well as doing some private practice. And currently, I'm in Victoria, and I've been in Victoria for about 18 months now, doing some work for Deakin, as well as providing telehealth services privately. The stereotype I hear the most is about rural and remote people, being stoic and not being help seeking. The barriers for getting help for rural and remote is not necessarily that they don't recognise that they need help or that they don't have the health literacy. It's really time and access. There's less access for people in rural and remote regions. Sometimes they're in really small communities and they actually want to seek help outside of that community because of how small the community is. A lot of my clients are on properties, and the time that it takes to get into a service and see someone, they can end up losing a whole day. I'm just really conscious that no rural remote community is the same as another. And I think that's a really important thing to understand is the context that they live in, the connections they have in their community, the supports that they have from their perspective. I think that probably what I would highlight is some of the things that I've experienced when there's been a grief and loss in a community, particularly when it's been a very young child or, a perinatal loss, is that the whole community is often really affected by what happens. Um, that idea of vicarious trauma, where we all share that trauma, becomes really true in rural and remote communities, particularly the smaller they are. And that can actually have a lot of benefits for the healing for the people that we're working with, but it can also have, a lot of difficulties as well because the loss is always being reminded of everybody. There's no anonymity. Everybody's quite aware of what you've experienced and they've experienced it with you. So I think that that's something that I'm always mindful of in rural and remote communities. It's that the strengths of those communities can also create some difficulties for parents who have lost a child, whether it's in miscarriage or, in the early years of that child's life. I heard a mother talk recently about that, generally in Australian culture, we don't really grieve well. We don't have rituals around grief and loss that really help parents that have lost a child or are about to be parents who have lost, a pregnancy. And I think that that's a really important thing to highlight is that the Aboriginal and Torres Strait Islander cultures have, rituals that happen around grief. Whereas in general, outside of those sort of cultures, we don't really have those rituals. I think in rural and remote communities, what they do well is they come together and they create a space around, families, parents, whoever it is that's experienced that loss. And they do create a ritual in that community support. But like I mentioned before, sometimes that can also mean that that loss is always present and not necessarily in healthy ways. One of the things that I talk to people about, whether they're rural or remote or not, is creating their own ritual around that loss that makes sense to them in the context that they live, in the cultures that they're from, and allows them to have a really healthy grieving process. I find that creating space for that listening is probably the tool that I use the most with rural and remote. And I practice in more urban centres as well as rural and remote. Rural and remote people want to know you as much as you want to know about them so that you can support them. They need to know that you're somebody they can trust, that you get the context that they work in, that they can be comfortable with you, and you don't have to have lived rural and remote to provide that space for them. It's just spending a bit more time around understanding where they are, the region they live in, the supports they have, and their connection to the region they live in, I think is really important. The main thing that you need to do differently is understand what resources are available. There aren't always a lot of resources available to rural and remote people, and even if those resources are available, it's understanding whether or not they want to access them, because there might be barriers to access. Maybe, a service is run by a cousin or a friend, or there's a reason why they don't want to access that service. I think that one of the things that I spend a fair bit of time in rural and remote doing is understanding where they live, understanding the barriers to access for different services. The other thing that I like to understand as well is internet access. So, a lot of rural and remote people are relying on telehealth and relying on telephone services, and they don't always have the best access. So I always think about backup plans. For my clients that I speak to on video link, telephone might be the backup. There might be other ways that we can communicate if things go wrong, things that you don't expect to go, change things. It's not just weather events. Really hot day and long reach can create whiteouts and you've lost your connection on and off for little 1 minute stints, but it affects telehealth. So yeah, just spend a bit of time with your rural and remote clients, just understanding some of the things that I've spoken about with smaller communities is that everyone rallies together. But part of that also is a pregnancy has an impact in a community as well, and everyone's sharing the joy of that pregnancy, and everybody will share the grief of that loss. And I think that that can be a really a beautiful space for parents or parents to be that don't actually get to become parents, in that they are well supported by their community. But in other ways, it can also be really hard for them because there's other members of that community that have a child, that have had a successful pregnancy, and they're wanting to share that joy, but at the same time that they're grieving. So I'm always really conscious that grief can be a little bit more complicated in rural communities, and there can be other things that come up for them that make it really hard. I think in rural and remote, what I love the most is that the psychologist doesn't work alone. So I'm always wanting to know who else is in their support team. Quite often there could be a bush nurse or a GP that's really supportive, or another service, particularly in perinatal loss, is another service that's giving them on the ground support and with connections in their community. And we're helping them with the mental health side of that grief and loss. So don't ever feel when you're working with people that have experienced this type of loss that you're working alone, because there's opportunities to connect in with a larger team that's on the ground.